Welcome, curious minds, to the deep dive. Today we're plunging into a really crucial topic, atypical myopathy. It's a devastating, often fatal muscle disorder that can strike horses, well, seemingly out of nowhere. We've pulled together a rich stack of sources for this deep dive detailing this condition. You might also know it as seasonal pasture myopathy or even sycamore poisoning.
Mhm.
Our mission today is to cut through the complexity, give you the absolutely essential insights. We want you to walk away understanding this silent pillar, how it works, what signs to look for, and most importantly, how to prevent it. It's really about being informed and ready.
It really is. It's a classic case of a serious threat hiding in plain sight, often literally right under our horses' noses. So yeah, we're going to unravel the specific plant toxins involved, trace their pretty dramatic impact on a horse's body, and then hopefully arm you with the critical steps for diagnosis, treatment, and proactive prevention. It's a journey into understanding a profound vulnerability and how to guard against it.
So let's kick this off then. What exactly is atypical myopathy at its core? And what makes it so incredibly dangerous?
Essentially, atypical myopathy, or AM, is a devastating form of muscle breakdown. But importantly, it isn't caused by overexertion, it just happens. It's a severe form of what we call non-exertional rhabdomyolysis. And the culprit is a specific toxin called hypoglycin A. Horses ingest this from certain Acer tree species.
Acer species, like maples.
Exactly. We're primarily talking about the box elder, Acer negundo. You find that mostly in the Midwest, US, and Canada. And also the sycamore maple, Acer pseudoplatanus, which is prevalent in the UK and Northern Europe. Horses typically get this toxin by eating the seeds or sometimes the young seedlings of these trees.
So this toxin hypoglycin A, once it's inside the horse, how does it, unleash such chaos? What's the mechanism?
Right. Here's where it gets really interesting from a biological standpoint. Once ingested, hypoglycin A is metabolized. It changes into a different form. And this metabolized form is insidious. It directly inhibits a crucial enzyme. It's called a acyl coenzyme, a dehydrogenase.
A cell coenzyme, a dehydrogenase.
Okay. Bit of a mouthful, I know. But inhibiting it massively disrupts aerobic metabolism. That's how muscle cells generate their essential, long-lasting energy. And the result is severe damage, specifically to type I muscle fibers.
Type I fibers. For our listeners, maybe not deep into equine physiology, can you quickly sketch what aerobic metabolism means for a horse and why hitting type I fibers is so bad?
Absolutely. Great question. Think of type I fibers as the horse's marathon muscles. They're the ones working constantly for standing, breathing, just maintaining posture. They rely on a steady, super efficient energy supply from aerobic metabolism. It needs oxygen. So when hypoglycin A shuts down that key enzyme, it's like suddenly cutting the fuel line to these critical, constantly working muscles. They literally run out of energy.
To just start dying off.
Exactly. They begin to die. And that leads to the profound weakness, the organ failure, and the widespread destruction we see in these cases. What's truly devastating here is the widespread necrosis. That's the technical term for cell death of muscles. We're talking skeletal muscles, obviously impacting movement, but also vital respiratory muscles. Breathing becomes incredibly difficult, and even cardiac muscles, the heart muscle, in about 50% of cases, which can lead to heart failure.
Wow.
Yeah, so this leads to profound weakness, difficulty breathing, and a horrifying, often quite visible sign: myoglobinuria.
Myoglobinuria, you mentioned, that sounds serious.
It is. It's when myoglobin, which is a muscle pigment, gets released from all those damaged muscle cells into the bloodstream. Then it gets filtered by the kidneys, and it turns the urine this dark red or brown color.
My Coca-Cola colored?
Sometimes, yeah. And this isn't just a color change. It can lead directly to severe kidney damage, kidney failure even.
So that dark urine is a huge red flag.
A massive one. It tells you there's serious muscle breakdown happening right now. Ultimately, a high proportion of affected horses, sadly, succumb to the disease because of this cascade of events.
Myoglobinuria, that's a terrifying visual, a clear sign of systemic crisis. It really hits home how fast this can become life-threatening. So let's pivot now to the crucial question for owners. Who exactly is most at risk? And what are those critical early warning signs we absolutely need to be vigilant for?
Good question. While really any breed or gender can be affected, we do tend to see horses under 3 years of age being perhaps more susceptible. Risk factors are often tied to pasture conditions. Things like extensive pasture access, maybe over 12 hours a day, dietary indiscretion, horses eating things they normally wouldn't, competitive feeding situations where some might be pushed to less desirable areas, and definitely lack of supplemental feeding, especially during cold or bad weather when grass is scarce.
And overgrazing.
Yes, Overgrazed pastures dramatically increase risk. Horses are driven to consume less palatable forage, and that might include these toxic seeds or seedlings.
So if I'm listening now, thinking about my own pasture setup, what's the very first thing that should make the alarm bells ring? Is there one sign that's maybe most common or maybe easily missed?
Well, symptoms can appear really rapidly, often within 6 to 72 hours, though it can take up to 4 days after they actually eat the toxin. The first thing you'll likely see is just general weakness, lethargy, muscle stiffness. But this can progress frighteningly quickly to recumbency, the horse being unable to stand,
Right.
and potentially death within 72 hours.
So fast.
Incredibly fast. And while that profound weakness is common, that discolored dark red or brown urine, the myoglobinuria we talked about, that's often the most visually striking and alarming sign. It screams severe internal damage. You'll also see other signs: increased heart rate tachycardia, respiratory difficulties. They might be profoundly depressed, really reluctant to move at all. Interestingly, though, despite what must be severe muscle pain, sometimes horses maintain an appetite. That can actually help differentiate it from, say, a true gastrointestinal colic.
That's a useful distinction.
It can be. Sweating and shivering can also occur. And in the worst cases, tragically, sudden death without any prior observed symptoms is possible. And another thing, don't forget subclinical disease. Pasture mates might be affected, might have ingested the toxin, but aren't showing obvious signs yet. Or maybe never will.
Right. So just because one horse is sick doesn't mean the others are fine.
Exactly. They all need to be checked.
That's a lot to process, especially how fast it moves. Okay, now we understand the impact. Let's talk diagnosis. How do vets actually pin this down definitively?
Early and rapid diagnosis is absolutely critical. It really dictates the chance of survival. The first step is always a detailed exposure history. Has the horse been in a pasture with box elder or sycamore maple trees? Or are there seeds or seedlings? Were there recent strong winds? Floods? Things that could spread seeds further than usual? Is the pasture sparse, overgrazed? All these questions.
Getting the context.
Precisely. Then, clinical signs during the physical exam are crucial, of course, but laboratory tests are what give us the definitive answer. Blood work is usually a massive red flag. You'll see dramatically elevated muscle enzymes. Creatine kinase, CK, we're talking levels in the tens of thousands, even hundreds of thousands IUL.
Wow, compared to normal levels.
It's off the charts, completely abnormal. Signals widespread, catastrophic muscle destruction, aspartate aminotransferase, AST, will also be very high. Interestingly, while the toxin itself is hypoglycin A, horses can sometimes show initial hyperglycemia, high blood sugar, followed later by hypoglycemia, low blood sugar. Electrolyte imbalances are common too, and you might see elevated kidney parameters like creatinine and BUN showing the kidneys are under strain.
And the urine. Given what we said about myoglobinuria, that must be key too.
Absolutely. Urine analysis is vital. A simple dipstick test will be positive for blood or hemoglobin, but, and this is the key, microscopic examination will show no red blood cells, or very few.
Ah, so it's not blood, it's the myoglobin.
Exactly. That confirms the pigment is coming from muscle breakdown, not hemorrhage. The definitive diagnostic test, the gold standard, involves measuring hypoglycin A itself or its metabolites, things like MCPA carnitine in the horse's blood or urine, or even in plant samples from the pasture. Problem is, this testing can take days to get results back, so treatment usually has to start based on strong suspicion on the clinical signs and initial blood work.
Can't wait for the specific test results.
Yeah, you really can't. There's also something called the serum acyl carnitine profile, which can give vets a good idea about the prognosis, how likely the horse is to survive. That can be helpful too.
With such dramatic signs, are there other conditions that could look similar? Things vets need to rule out?
That's a really important point. Differential diagnosis is crucial. You need to consider things like severe laminitis, tetanus, colic, especially certain types, viral encephalitides like West Nile or EEE. Also, acute exertional rhabdomyolysis, tying up, though the history is usually different there. Selenium deficiency, white muscle disease, even toxicity from other plants like red maple in North America.
Lots of possibilities.
Yes. If a post-mortem examination is done, the findings are pretty clear-cut for AM. Massive skeletal and cardiac muscle necrosis, and acute kidney damage, specifically acute tubular necrosis. That confirms it.
This sounds incredibly challenging to treat, especially moving so fast. Is there, like, a specific antidote for the hypoglycin A toxin?
Unfortunately, no. There's no specific antidote for hypoglycin A. That's a major challenge. So treatment is primary supportive. And it needs to be extremely aggressive. The goal is to manage the toxin's effects and support vital organ function as much as possible.
Mm.
Early, intensive intervention significantly improves survival chances. This almost always means hospitalization, often in an intensive care unit with 24-hour monitoring and care.
So step one is get them off the bad pasture.
Immediately. That is the absolute first priority. Remove the affected horse from the contaminated pasture and get them into a clean, deeply bedded stall, comfortable, quiet. And crucially, any other horses that were on that same pasture must also be removed immediately and monitored very closely, even if they look fine right now.
Right, because of that subclinical risk.
Exactly.
Okay, so horses off the pasture, in the clinic. What are the key treatments vets start deploying?
Intravenous fluids. Lots of them. 4V fluid therapy is crucial. It helps protect the kidneys from that myoglobin-induced damage, flushing them out, and maintains hydration. Glucose supplementation is often added to the fluids
Why glucose specifically?
because the toxin severely disrupts energy and glucose metabolism. So providing glucose directly helps. Sometimes insulin might even be needed if they develop hyperlipemia, which is high fat in the blood. Pain management is also critical. These horses experience severe muscle pain, so potent analgesics are used, things like flunixin, meglumin, bitorphenol, maybe lidocaine, sometimes given as a continuous drip, a CRI, for constant relief.
Any pain meds to avoid?
Yes, very important point. NSAIDs, like phenylbutazone or even flunixin if used excessively, should generally be avoided or used very cautiously in horses that already show signs of kidney problems like azotemia or myoglobinuria or are in shock. They can make kidney damage worse. Muscle relaxants can also help. Methocarbamol, maybe gantrelline, to ease the muscle stiffness and tremors.
And what about feeding? You said they sometimes keep eating.
Yeah, nutritional support is vital if they're willing to eat. We aim for easily digestible high-carbohydrate feeds. Molasses is often good. Avoid fats because fat metabolism is also disrupted by the toxin. L-carnitine supplementation is often recommended. Carnitine helps transport fatty acids for energy, so supplementing it might help bypass some of the metabolic block. B vitamins, vitamin E, selenium, antioxidants, and cofactors are usually given too.
And for horses that can't stand, the recumbent ones.
That's a huge nursing challenge. They need very deep bedding, and they have to be turned regularly every few hours to prevent pressure sores, which can develop really quickly. Bladder catheterization is also frequently necessary. The muscle weakness can affect bladder function, so they might not be able to urinate on their own.
It sounds like incredibly intensive, round-the-clock nursing care.
It absolutely is.
Given all that and the lack of an antidote, what's the typical outlook, the prognosis?
Honestly, atypical myopathy carries a guarded to poor prognosis. It's a tough fight. Mortality rates typically range from a pretty daunting 40% up to 80%.
So potentially only 1 in 5 survives the worst outbreaks.
In some situations, yes, it can be that devastating. There are key prognostic indicators vets look for. A big one is whether the horse becomes recumbent, unable to stand. Early recumbency signals a significantly worse prognosis. Persistently high heart and respiratory rates, despite treatment, are also poor signs. On the positive side, seeing a decline in those really high CK levels and seeing clear improvement in the clinical signs within the first 24 to 48 hours. Those are very encouraging signs. Horses that manage to survive the first, say, 3 to 5 days generally have a much better chance of pulling through.
And for the ones that do make it through that initial crisis, what about long-term complications? Is it a full recovery?
Well, possible complications can include lasting kidney problems, acute or even chronic renal insufficiency. Cardiac dysfunction, heart issues can persist too, and atrophy or wasting of the skeletal muscles that were damaged, particularly those type I fibers. Survivors need months of rest and careful rehabilitation. Reevaluation, definitely including a check of their cardiac function with maybe an ultrasound or ECG, is strongly recommended before they return to any kind of exercise or work.
So recovery takes time.
A long time. While serious long-term effects are, thankfully, considered rare in horses that do survive, the road to full recovery is definitely long. It demands a lot of patience and diligent care from the owner. And, we connect all this back to the bigger picture, it becomes abundantly clear that prevention is just. It's by far the most effective strategy against atypical myopathy. It's all about proactive vigilance.
Right, avoid the crisis in the first place. So given everything we've covered, what's the single most important thing horse owners can actually do to safeguard their animals?
Pasture management. It is absolutely paramount. The core strategy is to identify and, if at all possible, remove sycamore or box elder trees on or very near your pasture.
Removal is best.
Ideally, yes. because those seeds, the little helicopters, are masters of dispersal. They can travel astonishing distances on the wind, up to 200 meters, sometimes even further.
Wow, that's far.
It is. So even a neighbor's tree can be a risk. If removal just isn't feasible, then you absolutely must fence off any areas where seeds and seedlings are likely to fall or accumulate. Pay special attention in autumn during the main seed fall, and again in spring when the seedlings germinate. Those are peak risk times.
Okay, so identify, remove, or fence off. What else?
Beyond that, regularly inspect your pastures. Clear up fallen seeds, leaves especially in drifts, and any germinating seedlings. Paddock vacuums, those manure collectors, can be incredibly useful for this task. And a really important point, if you mow over seedlings, you must remove the cuttings. The toxin remains potent in the cut plant material. Mowing alone doesn't solve it.
Right, you're just chopping it up, not destroying the toxin.
Exactly.
It sounds like horse owners really need to become like amateur botanists and pasture detectives. Are there other management tips to lower the risk?
Absolutely. Avoid overgrazing at all costs.
Mm.
Make sure your horses always have enough good, palatable forage available. This means providing supplemental hay, particularly during those high-risk autumn and spring periods or anytime the grass is sparse. The idea is to discourage them from foraging for less desirable things, which is when they might pick up those toxic seeds.
Makes sense. Keep their bellies full of good stuff.
Precisely. And a critical warning here. Never, ever make hay or silage from pastures that are contaminated with sycamore or box elder material.
Because the toxin survives drying.
Yes, the toxin can persist in the dried forage, so that could pose a year-round threat, not just a seasonal one. One more nuanced detail, often overlooked. Natural water sources. If you have a stream or pond in a pasture with these trees nearby,
Uh-oh.
yeah, be aware that HGA, the toxin, is water-soluble. It can leach from fallen seeds or leaves into the water.
So they could drink the toxin.
Potentially, yes. So always provide an alternative, clean, fresh water source, like a trough filled with clean water, away from the trees. And finally, you might consider limiting turnout time, especially during those high-risk autumn and spring periods. Or maybe stabling horses overnight, particularly if you know you have these trees nearby and can't remove or fence them effectively.
So it really boils down to constant informed awareness, almost like doing surveillance on your own property.
Precisely. Owners absolutely must be educated about the signs of atypical myopathy. They need to be intimately familiar with what these trees, the box elder and sycamore maple, look like and what their seeds look like. Being extra vigilant during high-risk seasons, especially right after strong winds or frosts, which can cause massive seed drops or stress seedlings, that vigilance can truly make all the difference. It can be the difference between life and death.
What a deep dive into atypical myopathy. Wow. From the insidious action of that hypoglycemic toxin messing with fundamental cell energy to the really dramatic clinical signs, the dark urine, the muscle failure, and the incredibly intensive care required. It's profoundly clear why this condition is so feared among horse owners and vets.
It really underscores the critical importance of truly understanding a horse's environment, knowing the subtle yet potentially deadly dangers that can lurk within it. As we've really hammered home, proactive prevention and swift informed action are truly a horse's best defense against this devastating disease. There's just no substitute for that vigilance.
Yeah, this deep dive has certainly highlighted the profound impact that seemingly innocuous things in a horse's world like a tree can have on their health. It reminds us how vital it is to be informed, to be observant, vigilant.
And this raises an important question, maybe for you, our listener, to think about. Beyond these specific trees we discussed today, what other common, seemingly harmless elements are out there in our everyday environment? Things that might hold hidden dangers, maybe for our animals, or even for us, dangers that we rarely consider until, a crisis actually hits, something to chew on.